I'm James Gulley. I'm Chief of the Genitourinary Malignancies Branch and Director of the Medical Oncology Service at the National Cancer Institute in Bethesda, Maryland. Today, I'm going to talk about M7824. This is a novel bifunctional fusion protein that targets PD-L1 and TGF-beta. This agent, we did the first-in-human study at the National Cancer Institute, and we saw that we could give this safely in doses between 3 and 30 milligrams per kilogram in patients with advanced cancer. We also found that the safety signal was very similar to what you would see with PD-1 or PD-L1 inhibition in patients with cancer, with the one exception of keratoacanthoma. This is a low-grade tumor seen in the skin that typically does not require treatment and is thought to be associated with TGF-beta pathway inhibition. What we found also was that we could saturate all the PD-L1 in the periphery, and we could also sequester all the TGF-beta to below the lower limit of quantitation during all the time points analyzed, even right before you give the next dose of agent. What we found in this dose escalation group of patients is we enrolled 17 patients who were HPV positive, and we presented that at the American Society of Clinical Oncology meetings in 2018. And what we found was that this was an interesting group of patients where we saw preliminary evidence of activity. So it turns out that TGF-beta receptor signaling is dysregulated in patients with HPV positive HPV positive cancers frequently, as seen in the Oncomime and TCGA databases. In addition, if you look at PD-L1 and PD-1 targeted agents and the activity in HPV positive malignancies, you see documented response rates of between 16 and 21%. What we found in our group of patients is that of the 17 patients, 13 of them had assayed for HPV positivity, and 12 of them were positive. 1 was negative, and 4 were not assayed. There were 17 patients in total. 10 of them were cervical cancer, 4 of them anal cancer, and 3 of them head and neck cancer. We found an objective response rate in the 17 patients of 35%, and if you looked at just the HPV known positive patients, the response rate was 42%. So we think this is an interesting signal of activity in these patients. We also, as part of the phase 1 study, did an expansion cohort in lung cancer, and this was also presented by Dr. Pezarez at the American Society of Clinical Oncology meetings. In this group of patients, 40 patients were treated at the 1,200 milligram flat dose, and 40 patients were treated at the 500 milligram flat dose, which is just an idea to get if there's a difference in pharmacokinetics or pharmacodynamics or objective response rates between this group of patients. I'm going to focus on the recommended phase 2 dose of 1,200 milligrams. We did see responses in both groups, however. But at the 1,200 milligrams, what we saw was an objective response rate of 28%, which compares favorably in the second-line lung cancer setting to other PD-1 or PD-L1 agents that have been tested and published. In addition, if you look at the PD-L1 positive, when we define that as 1% or more of the tumor cells being positive, we saw an objective response rate of 41%. And if you look at the PD-L1 high, you see an objective response rate of 70%. Now, about 3/4 of the patients have PD-L1 positivity in lung cancer, so this is a substantial proportion of the patients. About 15 to 20% of the patients are PD-L1 high. So we think this is preliminary early data suggesting pretty nice activity with very well tolerated with this M7824. Thank you.